I suppose it's necessary in any discussion of learning problems and attention problems to say something about medication. Particularly since we have about 2.5 million of our kids in the country who are being medicated. You know, to my perception, it's a gargantuan problem. There is not a drug that addresses the causes of learning or attention problems. Okay. As I said, you know, if you had a bunch of 2-year-olds you wanted sitting quietly in a second grade classroom, you'd have to drug them. All right. And that's essentially what we're doing with most of the kids. And anyone who can pretend that there's not negative side effects of these drugs is kidding themselves. You know, the Ritalins and such actually slow down brain function as much as 30%. Cut down cerebral blood flow, oxygenation of the brain, all right, particularly in the frontal lobes. You know, who watched, you know, ever watched One Flew Over the Cuckoo's Nest? Okay? You know, the big operation in that was a frontal lobotomy, all right? Well, to a degree, the drugs do the same thing. They slow down the brain function. Now, why does that work? Because the lower the processing, the lower the global neurological maturity, the greater the distractedness, the greater the activity level, the more impulsive you are. Okay? That comes with that territory. If we medicate them, we're not fixing those problems. We're just drugging a child who neurologically is immature. So they're not so distracted. Okay? It's masking the problem. It's not addressing and fixing the problem. When we are trying to fix the problems, the more medications the kids are on, the more difficult it is because their brains are being slowed down. You know, it's a hard thing for a parent who has a child who can't function in the classroom and puts them on medication and they can function in the classroom. You know, it works. Well, does it? Okay. You know, I would encourage parents to address it by finding the causes and treating the causes. So enough said. We could spend the night on medications, and I don't think any of us want to go there, do we?